Earlier in the show, we talked to Aaron Durfel of the Montreal Gazette, and again, it's typically a story now about emergency rooms getting worse and worse and worse. We all know that story. This is nothing new. It's just the fact that it doesn't seem to change, and it just simply gets a little bit worse all the time. It puts in question the healthcare network in its entirety and how difficult things are right now. And of course, there's still the issue of, striking workers, et cetera, which doesn't help things. Part of the, I think, thing that doesn't necessarily get covered regularly, and this seemed to me to be a bigger thing once we initially found out, and this happened during the pandemic, right? When we had surgeries being put off, then it seems to me at some point the government says, oh, no, we're catching up now. Now that the pandemic is over and people are back, those wait times shouldn't be an issue. Well, I don't know if they lied or they just, didn't understand, but in fact, it's actually gotten worse. Paul Brunet is a patient rights advocate, president of the Quebec Council for Patients' Rights. He is on the line. Monsieur Brunet, thanks again for being here this afternoon. We appreciate it. So let me begin by asking you, when I say it's worse than it's ever been, what does that mean?
Oh, it's a record high. I've been a spokesperson for the past 25 years for the Conseil pour la protection des malades, and it's a record high. It's a record high for waiting lists for surgery. It's a record high for patients in emergencies. It's a record high everywhere. Long-term facility, home care, which was a priority from this government. They have added a few millions of dollars, but certainly not to the level that is we needed. We're talking about thousands of patients or people waiting for home care. And you know what? I think home care is part of the solution to the crisis and emergency of wards right now.
Yeah, but the government made a point. I said this to Aaron Durfel earlier, didn't they? Saying we understand we want to be able to provide services to, for home care, setting aside money, setting aside resources. Did that ever happen? Why are we looking at this now, getting worse?
I don't know. The CAC was elected with one of the promises, which was to bring the hospital at home. So we said, well, it's a halfway to the solution we're proposing, because guess what? Home care is about prevention also. Family doctors, I'm talking about family doctors, used to go and visit families historically. And when we stopped having had the family doctors going to the families and working in emergency ward, then that's when the emergency ward gotten with the kind of number of patients waiting we are assisting now. It is also almost coincidental that when the family doctors left the home service, that the emergency wards started to go as high in terms of waiting for patients. So when are we waiting for doctors to go back to home, see the kids, see the elders, prevent a lot of things that can be, settled with a doctor, not at emergency necessarily. In Verdun, may I repeat myself, in Verdun they are saving 50% of hospitalizations of elders very sick because doctors go by and see the patients, stabilize their health condition, change their medication, a lot of things that would prevent hospitalizations, and guess what? Save beds who are gravely needed for real urgent care. But for now, we all wait that everybody gets very sick. Then we lack ambulances, we lack beds, we lack ambulance drivers. What are we doing? Are we going crazy? We need to go upwards, work upwards and redo, like Adu Canada told me, it was another era. Well, guess what? This other era worked, but we're still, hospitalizing everybody and not preventing anyone from having to go. And now we need to build more beds. I was talking to some of your colleagues in another meeting. We're lacking ambulance drivers. What's going to happen?
Yeah.
The faster we're going to get the patients to the hospital, what are we going to do? They're going to die waiting to be treated? Come on. We're not serious. This is not serious. And then I heard this other doctor saying, well, we need to get the beds normally, entitled for emergency to be... It's like a dog chasing after its tail, It's sad because I've been a spokesperson for the last 25 years. We've been told, oh, that's not serious, that's not practical. But guess what? All the solutions that we were told that would be implemented were either not implemented or not doing the job.
All right, so let me go back to what you said earlier on, which was this government, when it got elected, promised to deal with these issues. I was asking Aaron Durfel earlier on about, the idea they would build more homes for seniors, et cetera. So homes have been built, but not accommodating necessarily clearly all the people that need to get that, kind of treatment from the government and go to those homes because there are no doctors to treat them at home, which you just outlined now. But my question is, the government obviously realizes this, right? These are numbers that are out there. They know what's going on. What have they said as to why this is going on? Do we simply not have enough doctors? Do people not want to be in the system? What is it?
Listen, not only the CAC, but even before them, under the Liberals and even probably, with the PQ in the 2010s. We are still, I've been commenting the problems with emergency wards for the past 20 years at least. Since doctors stopped going to visit patients at home. It's coincidental. It's coherent with what is going on because we've stopped seeing the patients before they needed emergency. Even a doctor working at an emergency unit who now retired said, Paul, the problem is not the emergency ward. It's everything else that is not doing its job. Let's work upwards for the causes rather go and try to solve the consequences. We work on consequences. We don't work on causes.
Sure. I get that. My question still, and I'm trying to understand, if the system worked, as you said, in another era and it worked fine, you'd think that would be a simple enough thing to try to replicate, right? But the question then becomes, why aren't doctors doing this? Is it them who don't want to do it or the government that doesn't want to bear the cost? What is it?
Well, as of now, I got two answers. First, the general practitioners unions don't want to send doctors back to home. It's a total refusal. And second, there's a group of very powerful people at the ministry that decided only nurses would go and serve patients at home, no doctors. So until we have better authority to decide what we want, and that doctors and other people at the ministry submit themselves to what the people in charge will order them to do, well, we will continue to comment on emergency wards and the catastrophe, and even worse today with the crisis and other illnesses that have come by. And, I don't know. Will Santé Quebec settle all this? I don't know. I just hope that we start thinking on a more general perspective rather than working on the consequences.
Paul Brunet, patient rights advocate. Thank you so much. Appreciate it, Paul.
My pleasure.